All right, so we are going to go ahead and get started. Hello, everyone, and thank you for joining us today. My name is Rebecca, and I am with MBNA. And over the next hour, we will take a deep dive into SALA and the MB Healthcare program. This webinar is being recorded, and all participants have been muted. We encourage you to use the Q&A and chat feature to interact with our panelists today. These features can be found by hovering your mouse over the bottom of your screen. It is my pleasure to introduce our speakers for today. We are joined by Kevin Kennedy and Rich Lawson with SALA. Kevin Kennedy is the CEO for the Small Association Leadership Alliance and a member of the founding committee. He has more than 20 years of diverse experience, having worked for more than 24 associations, professional societies, and nonprofits. Rich Lawson is the president for the Small Association Leadership Alliance and a member of the founding committee. He has more than 20 years of experience working for trade associations and professional societies. So with that, I will go ahead and turn it over.
All right, sorry about that, everyone. I was on mute. But good afternoon or good morning to all of you. My name is Kevin Kennedy, and I'll walk you through the presentation. If you have any questions, please feel free to send them in through the Q&A. But we'll certainly be on the webinar here for as long as we need to be to make sure we get all of your questions answered. But we are talking about the SALA healthcare program brought to you by MBNA. As you'll see through the slides, it's really an effort to simplify our complex healthcare system, and we'll walk through some of the pricing towards the end so you see how we accomplish that. A quick fact here, less than half of the US small businesses now actually offer healthcare. Last I saw, it was actually 43% that actually offer healthcare now, and certainly not sure where that might stand when we all get through the coronavirus here. On average, folks are able to realize a savings of right around 60% compared to what they would pay for traditional insurances on the state exchanges. We have folks that have realized savings more than that. Myself, where we live right outside the DC area, my savings are right around 55%. I'll walk through all the pricing, like I said, in just a little bit. And one last note there, last year, and we'll do it again this year, but we did a survey of all the participants in the program, and 91% said they were either very or extremely satisfied. So it is a program that's been well received, but it is different from traditional health insurance. This is not traditional health insurance that we're talking about here today, but the program that we have really involves two main partners, along with a couple other partners I'll mention throughout the presentation here. But one is Apex Management. They have a couple of plans to choose from, and those plans are really focused on preventive care. If folks then pair that with a membership to Sedaris medical cost sharing, and I'll spend most of the presentation today actually talking about medical cost sharing, as it may be a new concept for many of you. It certainly was for us when we first started talking with them a few years ago. But the program, and really our healthcare in general, has three main components to it, if you will. There are large costs, which we refer to as needs. And these are as you see there, hospitalization or maybe some diagnostic imaging or an ER visit, but the significant medical events that we all go through at different times in our lives. Then there's small to medium costs, which is more the run-of-the-mill type stuff we all have throughout the year, a cold, a sinus infection, the flu. And then there's preventative care, which is everything from childhood immunizations to annual physical, colonoscopies and mammograms when they come due. But the program addresses all three of these components, and I will walk through each one of them individually and tell you specifically how they are handled. But let me start up with some background on Sedaris and medical cost sharing. For those of you, like I said, who are not familiar with it, medical cost sharing actually originated in the 1980s, and has had really a foothold with religious groups. Different churches or congregations, ministries would form an organization through which all their members or parishioners could share in each other's expenses. Sedaris is not a religious organization. They don't have any religious affiliation. Their parent company is actually called the CARES Group, and the CARES Group is a medical bill negotiating company, and they're the company that many of these religious groups have used since the late 80s, early 90s to negotiate their larger bills. But when all of our healthcare costs really started to increase at just an unsustainable rate, the CARES Group formed Sedaris. It's built upon the same best practices as the religious cost sharing groups, but again, it does not have any religious affiliation at all. So why are we here, and why does medical cost sharing and Sedaris exist? And this slide perhaps presents it in the best light. They refer to it as the unsustainable squeeze. And in a nutshell, as you can see on the bottom there, total premiums over this 10-year period have increased by about 55%. The portion that the employees are responsible have increased by around 70%, but wages have only increased about 19%. So the unsustainable squeeze simply being that all the health insurance costs are simply increasing at just an unsustainable rate for many of us. So this option that we're talking about here today, I should have prefaced this, and I apologize. It's not a good fit for everyone, but it's a good option for many of us to consider, including those of us with certain pre-existing conditions as well. And I'll get through all that as we go through, but it's definitely an alternative for folks to take a look at. And Sedaris Objectives are really all of our objectives. It's offering the freedom to choose what doctor you go to, what hospital you go to. It's lowering our monthly expenses and then reducing our large medical costs. So when I get into the details of the medical cost sharing and the cost and how it works, you'll see that it really accomplishes all of those. A few comments on medical cost sharing. And as you see there, what makes it unique? Every member is a cash pay patient or a self-pay patient. So with Sedaris, you don't have an insurance card. And I'll get into the details on how the sharing works, but if the hospital or doctor offices ask you how you'd like to pay, you would tell them I'm a self-pay patient or a cash pay patient. The benefit there is actually on the bottom here, which means that it's freedom from networks. You go to any hospital or doctor you like to get the care that you need. Sharing is on a per need basis. So as opposed to many of us for all of our lives, I've had to deal with a calendar year deductible with the insurance company. Sharing with Sedaris works on a per need basis, and the financial responsibility is actually predetermined when you enroll. And I'll talk about that in probably 2 or 3 slides. One last illustration here on the growth of medical cost sharing. This is as of the end of 2017. I apologize, we're waiting on some newer information. But you can see the uptick really starts around 2012, 2011, and really starts to move up. And that's when all of our healthcare costs really just started to increase at just an unsustainable rate. By the end of 2017, there were well over 1 million people participating, insuring over $1 billion annually. So it's really caught on in the last number of years. So as we look at this slide again, I'm going to first talk about the large costs, which again we refer to as needs, and then we'll talk about the small to medium costs, and then preventive care. So let's talk about medical cost sharing specifically and the need and how all of this works. So what is a need? Well, a need is one or more medical expense caused by a single accident or illness. So what that means is, let's say you had a car accident and you broke an arm and a leg, for lack of a better example, that would be one need because it was caused by a single accident. It's not 2 events, if you will. Now, the member's responsibility is the IUA. That stands for the initial insurable amount. And this is what you select when you enroll. There are 5 levels to choose from: $500, $1,000, $1,500, $2,500, or $5,000. And that's what you're agreeing to be financially responsible for if when you have to use your Sedaris membership. So if we look at the illustration here on the left, this is someone who broke their leg. So the cost they would have would be for the ride in the ambulance, to stay at the hospital, surgery, diagnostic imaging, prescriptions, and physical therapy. All of these costs are wrapped up into that one need. So just to make the math simple, let's say the total cost for the broken leg was $10,000 and you had selected the $1,000 IUA, you would be responsible for paying that first $1,000. The balance, the $9,000, would be shared through the community and paid accordingly. And on the next 2 slides, I'll illustrate that a bit better on how that works. Now, when you enroll, if you enroll as an individual, you'd be responsible for the first 3 IUAs in a calendar year. If you enroll as a family, you'd be responsible for the first 5. If you had a 4th need or 4th medical event in the calendar year, it would be a $0 IUA, or if you had a 6 or more as a family, it'd be a $0 IUA. So when you look at this, and if you're trying to figure out what your maximum financial exposure would be beyond your monthly contribution, it would simply be 3 times the IUA you chose if you enrolled as an individual, or 5 times the IUA you chose if you enrolled as a family. So for myself, for example, I'm enrolled as an individual. I'm on the $1,500 IUA. So my maximum out of pocket in a calendar year would be $4,500, or 3 times that. And that's if I had 3 separate medical events, 3 separate needs. So it'd be, I broke my leg this month. 2 months from now, I broke my arm doing something else. 2 months after that, I had another medical event. But that's how you would get there. As a practical matter, we all have far fewer than that in the calendar year. But at least you're able to look and see what your maximum financial exposure is. Here's a real life example, and I'll illustrate a bit more on how the sharing works. This is a family with a young child who had a persistent ear infection. The family was on traditional insurance with a $5,000 deductible. This example actually comes from the CEO of Sedera prior to him joining Sedera. As you can see there, after a series of antibiotics and boosters, they went to an ENT who inserted tubes into the child's ears. On the left were their out-of-pocket costs with traditional insurance, with co-pays, and then the cost of the surgery was around $2,500. On the right, of course, if they had selected the $500 IUA, their cost would be just $500. Their out-of-pocket cost would be just $500. So the way sharing works is really two scenarios, if you will, just to simplify it a bit. One is if you have an emergency, let's say you broke your leg, obviously you go to the hospital, you get the care that you need. And when they ask you how you'd like to pay, you say, like I mentioned earlier, that I'm a self-pay patient or I'm a cash pay patient, please bill me. The hospital would then bill you, and you'd be responsible for uploading those bills to Sedera. So if the bills were, say, $2,500, you would upload those bills for $2,500. Your responsibility is the $500. So the check Sedera would send you would be $2,025. They would send you that check, and you would then pay your bills. The other way in which it works is if you have a surgery that is scheduled. In that event, you would call Sedera and say, I'm having rotator cuff surgery in 2 weeks. Wanted to let you know so I can open a needs case for sharing. At that point, Sedera may actually reach out to the doctor in the facility and look to prepay for that surgery. They will prepay if they get, obviously, a better deal in doing so. In fact, it was pretty eye-opening to us back in 2018 when we were doing our due diligence on the program. And we spoke to a couple of hospitals to get a better understanding of how this works. And they openly said if someone prepays for a surgery and pays cash, which is essentially what would happen here because you're not using an insurance company, they discount it 50%. So on average, through negotiations, either before or after, and oftentimes using the parent company, the CARES group, Sedera saves between 47 and 53% on surgeries and the like. So that's how the savings are realized. The needs processing itself, checks are generally arrived in 3 to 4 weeks. Everyone is assigned a need processor who handles their case from start to finish. And just so you know, when we actually did our survey of participants last year, the Sedera processing folks, they actually got the highest scores across the board in terms of how they handle and how they communicate with folks. So it's really a well-run organization. Now, there are some nuances to the plan. Like I mentioned earlier, the program itself is not an ideal option for everyone, but it's a good option for many of us to consider. These next 3 slides do very well in illustrating that, especially the third one when I talk about pre-existing conditions. But when we talk about this one first, when folks sign up, they have to commit to a few things. One is to strive to live a healthy and balanced lifestyle. Obviously, making smart choices like diet and exercise can improve one's quality of life, but it also keeps us all out of the doctor's office and out of the hospital. Now, striving to live a healthy and balanced lifestyle is obviously not legally binding. They're not going to make sure you're exercising and whatnot, but it is something members have to commit to try to do. You also have to commit to not use illegal narcotics and not to operate a vehicle while intoxicated. So what does that mean? That means if you're operating a vehicle while intoxicated and you have an accident and you're hurt and you have medical bills associated with that accident, those bills would not be shareable through the community. The principle there is that the community should not have to pay for someone's illegal activity. One last note here, tobacco users are certainly welcome to join, everyone is, but there is a $75 surcharge per month per household. So in other words, if you have a husband and wife who both smoke, it's only $175 surcharge per month, not 2. Lastly, the fine print down there, tobacco users over the age of 50 have a $25,000 per need sharing limit for the top 4 diseases associated with tobacco usage, which is heart disease, stroke, COPD, and cancer. Medications and prescriptions. So there are 2 types of medicines we all take, if you will. Those that are curative and those that are maintenance. Curative medicines are medicines we take for a period of time, right, until we're cured. So like you see there, they could be antibiotics or chemotherapy drugs. But the cost for the curative medicines are shared through Sedera and part of that IUA math that we just reviewed a few minutes ago. The other type of drugs many of us take, myself included, are maintenance medicines. And this could be for high blood pressure, high cholesterol, and overactive thyroid is probably the most common one we actually talk about. And I take it for rheumatoid arthritis. So these are medicines we take daily or weekly or however they're prescribed, and we'll do so for the foreseeable future. Now, if you enroll in Sedera and it's a newly diagnosed issue that you have, the first 120 days of that medicine would be shareable. For myself, for example, I've had rheumatoid arthritis for a long time. So when I joined with Sedaris, none of the cost of my medicines were shareable. But there is Liberty Benefits, which you can add on for $27.50 per month. To be frank, we don't have a lot of people who have found the need to add that on. There are third parties like GoodRx or CleverRx that folks can use to achieve great discounts, especially on very common medicines like high blood pressure and high cholesterol meds. Oftentimes they're less than $10 per month on these third parties. Myself, I use the Apex prescription program, which I'll talk about later in the presentation. But Apex, if you recall, has two options for folks to consider when they sign up. One of them has a great prescription drug program, and that's what I've been using for the last couple of years. So I'll talk about the Apex prescription program in just a few minutes. Pre-existing conditions. This is where we get the most amount of our questions. So I'll make sure I cover everything here. Now, a pre-existing condition is defined as anything you've had a symptom of or received treatment for in the prior 3 years or 36 months to signing up. Now, the way the restrictions work are, none of it would be shared in the first year. Actually, I'm sorry, let me back up for a minute. Let me use myself as an example with my rheumatoid arthritis. On the Apex plan, the Apex component of this program, which I'll talk about in a couple of minutes, going to my rheumatologist is covered. I pay a $50 copay. Getting my blood work done is covered. I pay a $50 copay. And like I said, my prescriptions are covered. I pay the copay there as well. What this is saying is on the Sedaris side, if I were to have a need, if I were to have a medical event as a result of my rheumatoid arthritis, let's say I needed surgery. If that happened in the first year, I would be 100% responsible for the cost of that surgery. If it happened in year 2, up to $15,000 of that cost could be shared through the community. In year 3, up to $30,000 would be shared. After that, it's fully shareable. So I was talking about the program not being a good fit for everyone, but being a good option for probably 80% of us to consider. This is really the slide I was thinking about. For myself, with my condition, it's a chronic condition. I've had it forever. I'll have it for forever. But there's nothing on the horizon, if you will, in terms of a need, in terms of a medical event. I don't need surgery or any sort of therapy. I simply take my prescriptions. I get my blood work done a few times a year, and I see my doctor. So for me, it was not a second thought as to whether or not this would work for me. But let's say I had an active cancer when I went to sign up, or say my wife was pregnant. Now would obviously not be the time for us to join, because those would be pretty serious pre-existing conditions. That would obviously create a pretty large financial burden for myself and my family, especially in that first year, and perhaps even the year 2. So when I say we get the most questions on the pre-existing conditions, this is the reason why. If anyone has any questions about their condition, or if it's something that needs to be disclosed, or any question about how the sharing works or how the restrictions work, at the end of the presentation, you'll see our emails and phone number. Please reach out to us. Obviously, the last thing we want anyone to do is sign up for this program and all of a sudden be stuck with a large bill that they didn't realize was they had a condition that was not shareable. So when it comes to pre-existing conditions, please ask all the questions you can before you sign up. It's the biggest question that we get, and we obviously want to make sure everyone completely understands how it works. But hopefully I explained it well enough for you to get a good idea if this would work for you or not. Now, included with everyone's membership is a subscription to Teladoc. Telemedicine's obviously been in the news quite a bit the last couple of months, but Teladoc is actually the largest prescriber of telemedicine in the US. In fact, telemedicine's actually been around for a number of years. As of the end of 2018, I know more than 75% of Fortune 500 companies offer telemedicine. And the reason is it's a money saver and a time saver. It's a money saver for the user because there's no additional cost in using it. You can call them anytime you want, as many times as you'd like, and there's not a copay or any additional out-of-pocket cost for you in doing so. The doctors are board-certified licensed physicians, and they can prescribe a prescription for you and send it to your local pharmacy. So Teladoc and telemedicine in general is great for the smaller stuff. If you will, let's say you're sick and you need a Z-Pak, or I think a great example we've had was a woman who had an eye infection. She did a video call with the doctor. He diagnosed it and sent the prescription to her local pharmacy. So you connect with the doctors virtually over the phone or through your computer, so you can do it from your home or your car, your office, or wherever you might be. And the great thing I like about telemedicine is if you need to talk to a doctor at 2 o'clock in the morning, you can talk to a doctor at 2 o'clock in the morning. So it's really just an awesome service. And I know it's, like I said, been in the news quite a bit recently, but it's been an outstanding service for a while. In 2019, for example, more than 40% of our participants in the program use their telemedicine subscription. So it's used and probably been used quite a bit more recently. Also included is Second MD. Second MD is a great way to get a second opinion on anything you're going through medically speaking, of course, and it's from some of the nation's top doctors that practice at places like the Mayo Clinic and Johns Hopkins and elsewhere. Second MD is there for two reasons. One, there was a survey that showed the average physician was 13 years behind on his or her continuing education. I apologize for the background noise. I have a dog over here. He's trying to dig a hole into the carpet. So I apologize if it's noisy on my end. So Second MD exists so that we all have access to the most up-to-date medical information out there on anything we're going through. And there's no charge for using their service as well. The second reason it's there is that if you're having an elective surgery, Sedera requires you to get a second opinion, and you do that through Second MD. And again, it's done so virtually. It generally takes a day or two to pass information back and forth. The important thing here to note is that that opinion from Second MD is not binding. You and your doctor make the decision for what's best for you and your health. Again, this is just Sedera making sure that we all have access to the most up-to-date information and get all of our questions answered. But that's it for the Sedaris component of the program, if you will. Again, the main focus of Sedera is obviously on the large costs and the needs, and that's where the medical cost sharing comes into play. Teledoc and the other ancillary services are also offered, and again, offered at no additional out-of-pocket cost for folks to use them. But now I'm going to switch gears and talk about the APEX plans. The APEX plans are really focused on preventive care, but they do also have components in there to help on the small to medium costs as well, depending on which plan you choose. So the first option on the APEX side is the basic plan. As you'll see, it covers all of your preventive care needs 100%. So it's everything from, like I said earlier, childhood immunizations to annual physicals, colonoscopies, and mammograms. These are all the items that the Affordable Care Act defines for all of us: 21 for adults, 28 for women, 31 for children. And if you recall, when the IRS was issuing penalties for folks who did not have adequate healthcare coverage, it was because they did not have their preventive care items covered. So even though those IRS penalties have gone away, I know other states have implemented the penalties and others are considering it. So it still meets all of those requirements and making sure that you have a plan that covers all your preventive care. Now on the basic plan, it's important to note that that's all it covers. It doesn't cover anything else. So if you want to go to your primary care physician because you have the flu or you're not feeling well, you'd be paying for that office visit out of pocket. The basic plan does meet the federal requirements though to set up a health savings account. An HSA, as you may or may not know, is a great way to put away tax-free dollars to be used down the road towards any future qualified medical expense, such as dental, vision, prescriptions, doctor visits, and also to pay your Sedera IUA. Now, probably 30% of the folks who have enrolled in the plan, maybe a bit more than that now actually, have chosen the basic option. And they are folks that are in good health, not necessarily on any prescriptions. They don't go to the doctor, unless for preventive care items. And it's a great option for them to get all their preventive care covered and set up a health savings account. To be honest, if I did not have rheumatoid arthritis, I would be on the basic plan and I'd be taking advantage of the HSA. And even if I had to pay for a few things out of pocket, I would still be ahead of the game. I'll explain to you why I'm on the Advantage plan here in just a minute. But the HSA contribution limits in 2020 are $3,550 for individuals, $7,100 for families, and of course, those over 55 can contribute an additional $1,000. And like I said, an HSA is not use it or lose it. It carries over year. And when you turn 65, you can even convert an HSA into an IRA if you chose to. So it's a great way to put away some tax-free dollars. Like I said, though, I am on the Advantage plan, and most people are as well. And I'll explain why as I go through this. But again, the Advantage plan covers all of your preventive care items 100%, as the same as the basic plan. It then has a more familiar co-payment structure. So if you go to your primary care physician, it's a $20 copay. If you go to a specialist, for example, when I go to my rheumatologist, it's a $50 copay. My blood work or any other lab and imaging work's a $50 copay. And then the Advantage plan has the prescription drug program. So the reason I'm on the Advantage plan is one, the nature of my condition. I have to see my rheumatologist every 3 to 4 months. I have to get blood work done every 3 to 4 months, and I have to take prescriptions. So financially for me, the Advantage plan was the best way to go. The prescription drug program, like I mentioned earlier, this is how most folks get their prescription drugs filled. Many do use GoodRx or CleverRx or others as well. But as you see here, it sets up like many traditional prescription drug programs, tier 1 and 2 generics, tier 3 preferred brand name. There are limitations on tiers 4, 5, and 6. It's important to note, if you recall back to that prescription program or prescription slide when I was talking about Sedera, the curative medicines, which are shared through Sedera, are generally tiers 4, 5, and 6. The maintenance medicines, high blood pressure, high cholesterol, my rheumatoid arthritis medicine, for example, those are generally tiers 1, 2, and 3. So for the maintenance medicines that many of us are on, it's a great prescription drug program. It does not cover everything, and we can certainly look up any drugs that you may or may not be on and tell you the price prior to you signing up as well. So again, if you have any questions on the prescription drug program, please let us know. I should have mentioned this earlier. What a lot of people do, if they're on a simple prescription like a high blood pressure medicine, is they will sign up for the basic plan. They will use GoodRx to get their prescriptions filled, generally less than $10 per month. And when I get to the cost of the program, you'll see they still come out ahead, even if they pay to see their doctor, 1 or 2 office visits per year. But for myself, just with my condition and the ongoing care I need, the Advantage plan was the best option for me. Now, when I talked about the Sedera membership, I made sure to note that Sedera did not use a network. You can go to any doctor you like or any hospital you like to get the care that you need. On the Apex side, they use the multi-plan network. The multi-plan network is actually the largest network in the US. It's used by thousands of healthcare programs like ours. There are more than 900,000 doctors who participate in the network and tens of thousands of facilities. So it's really the best network we could have as part of this program, for a national program. Generally speaking, if you're in a more populated area like I am here in the DC area, and you run a search for doctors, you will find hundreds, if not thousands. This zip code is actually a good hour south of DC. You'll see for primary care physicians, there are 475. If I ran it for my local area, there would be thousands. If you get into more rural areas, like we have participants in parts of Alaska and more rural areas in the lower 48, you may have to drive a bit to find your doctor. But like I said, it's the largest network in the US. It's used by thousands of participants. And we can certainly give you directions or even query the database to make sure that your doctors are in network, or certainly give you a list of all doctors in network for a given zip code or any locale. So just, like I said, just let us know. We can send you those directions anytime. But let's talk price and more of this cost. It's important to note that we're all paying the same price regardless of our sex, regardless of where we live. The pricing is all the same. This first slide here is obviously for the Apex plans. You see on the left, of course, is if you enroll as a member only or an individual, or you and your spouse, or you and just the kids, or you and your whole family, meaning spouse and children. The basic MEC plan, again, only covers preventive care, doesn't cover anything else, but it starts at $71 and goes to $102. And then the Advantage plan, which has the copay structure, and then the prescription drug coverage starts at $144 and goes up from there. That red arrow is just actually the plan I'm on, and I'll show you a summary here in a couple of slides of what my costs are. Once you pick the Apex plan that best fits you and your family, you then select the Sedera membership, an IUA that best fits you and your family. There are 5 IUAs to choose from. For space reasons, we only have 2 of them listed here, but there is a $500, $1,000, $1,500, and then $2,500 and $5,000 IUA. The most common ones that people choose are the $1,000 or $1,500, but you can certainly choose whatever you'd like. On the left here, you see MO is member only, MS is member and spouse, MC is member and just the kids, and MF is member in the entire family, meaning spouse and children. And it's then banded across the top by age, for those in their 20s, 30s, 40s, 50s, and 60s. And again, you see the red arrow here next to the plan or the IUA I selected for $175.51 per month. So just for an example case here, and this would be the same for everyone who was in their 40s and made the selection that I did. I'm on the Apex Advantage plan for $145 per month. And again, I'm on that plan because I need the ongoing care and I need the prescription drug coverage. So financially, that made the most sense for me. I then selected the $1,500 IUA with Sedera. So if, again, each need that I encounter, my out-of-pocket would be $1,500 for the first 3 needs in the calendar year. To be honest, in the last 2 years, I've not had to use my Sedera membership, knock on wood. Probably shouldn't have said that. But my monthly cost is $320 per month. And just as for comparison, I was on the local Blue Cross Blue Shield plan here in Maryland, and my savings was right around 55%. And the biggest point for me as well was instead of having to deal with a $7,000 deductible that I had to meet each year, I have a $1,500 IUA that I'm responsible for on a per need basis. So it certainly saves me a lot of money on the front end, but if and when I do have to use my Sedera membership, it will save me a lot of money also on the back end. On the MBNA website, it's a great website filled with a lot of information, but there's all the details on the current rate sheets, details on Sedera, Apex plans, telemedicine, second D, and multi-plan. And give me a second, we had a question come in. The question is, does your entire company have to be on board like a normal medical plan, or can random people on this use this option? Random people can use it. I will go through those details actually on this next slide. So it's available in 45 states right now. It's temporarily unavailable in Vermont, Alaska, Washington, and then New York and Illinois actually starting tomorrow. But does not need an employer sponsor. Individual employees can join, full-time, part-time, or seasonal, hourly or salaried staff, but the cost can be paid either by the employee or the employer. One caveat there, of course, is your company has to be a member of MBNA. But you can offer this to some of your employees, one of your employees, all of your employees. It's really up to you. You can also offer this as an option if you want to also offer a more traditional insurance plan alongside this one. You can do that as well. And then in terms of the employee's cost or contribution, that's up to you to determine. A lot of people, I think, pay for $100 or so of their employees' costs is kind of a generalized average of what we felt out just from talking to people. But whatever you want to contribute toward that, you can. You could set it up to where your company is billed directly, and then you offset that with a payroll deduction. Or like I said, you can offer it for your employees to sign up individually and enroll on their own. Like I mentioned towards the beginning, on average, people are able to realize a savings of right around 60%. And then one last thing to note, and I apologize we don't have the slide up yet, but there is a dental option available. It uses the Aetna network. It sets up just like every other dental plan that I've ever had, at least. There's not necessarily a large cost savings there, but there is a dental option that you can add on as well to the enrollment period. One last slide, and I'll jump back and make sure I answered that question well enough. If you want to reach out to us and you're enrolled in the program, that top email is the best way to do it. It puts you right into the queue, and we generally get back to you within a few hours. You can also call, of course, at 888-994-4979, or you can email us anytime at healthcare@small-associations.org. I should mention that if we do this presentation, obviously, with MBNA, but we also do a number of these presentations one-on-one direct with the employers as well. So if you ever want to talk about it one-on-one or with you and your staff, just let us know. We can set up a similar time and go through the entire program as well. But Alicia, hopefully I answered your question on that. If not, just let me know. Okay, good. Any other questions out there? Again, the biggest question we get, and I'll jump back to that slide, is the pre-existing conditions. It's probably the pre-existing conditions and prescriptions. People make them understand how what their prescriptions would cost. On the prescription side, just reach out to us anytime. We can look up the pricing. We can even tell you what it would cost at different pharmacies in your area. The pharmacy benefit managers, Citizens RX, and their website is actually great with information like that. On the pre-existing conditions slide, again, it's anything you've had a symptom of or received treatment for in the prior 3 years to signing up. Depending on your condition, it may or may not make sense for you. Like I said, with mine, it certainly did. And with many folks, it does as well. I kind of gave you an obvious one there with the pregnancy or with an active cancer. But if you have any questions about any of this, please talk to us before you enroll and make sure you get all your questions answered. The enrollment process itself is really quite easy and pretty straightforward. If you're enrolling as an individual, you actually find the enrollment link through the MBNA website. If you want to set up your company to where your company is billed and pays the bill, and then you offset that with a payroll deduction, we do have just a simple one-page form that you would need to fill out. It has basic company demographic information and then your banking information that we would need to set you up. And I apologize, my dog is about to bark, so apologies in advance. Anonymous asks, is there a maximum dollar value that the plan will pay out? No. I think you're thinking of a short-term medical plan where they have caps of $1 million or $2 million or whatnot. This does not have that at all. There are pretty extensive guidelines on the program itself. If you want to get into the nitty-gritty, you of course get them before you enroll, and they are also on the MBNA website. But you can reach out to us as well. I can send them to you or send you the link. It talks about all this in great detail as well. Just let us know. Hopefully that answered your question, Anonymous. From Kelly, Did you say the plan will be available in Illinois in May? No, Kelly, I'm sorry, the plan will not be available in Illinois starting May 1st. I apologize if I said that backwards. Sedera, they're talking with Illinois and New York to make sure Illinois and New York are completely understand medical cost sharing. Some additional background for you, if you will. The healthcare ministries, the religious groups, they have a carve out for their program offerings in all states and federally. Since Sedera does not have that religious component to that, they are simply pausing in Illinois and New York to make sure Illinois and New York understand that they are essentially the exact same thing as the ministries, just without the religious component. So it's a courtesy that Sedera is doing with Illinois and New York. I can't tell you, Kelly, want to be turned back on. It could be a month. I don't know, but you certainly should check in with us anytime and we can let you know. That also means that people who are currently enrolled in New York and Illinois, they continue to be supported by us and by Sedera and whatnot. It's just a matter of not bringing new people into the program until they resolve it with New York and Illinois. Any other questions? Hopefully I didn't go through anything too fast. I think I answered most of the questions that people generally ask. Now, again, if you have questions, reach out to us anytime. We can set up a call. We can communicate through email, whatever you prefer. But we want to, like I said, make sure we get all of your questions answered before anyone enrolls. But Rebecca, unless there are any other questions, I'm going to throw this back to you.
Awesome. Thank you guys so much. For everyone in attendance today, we will also be circulating this contact information that Kevin shared. I believe it is also available on our website. So if you haven't looked on our website, it's a pretty good resource. And it also takes you to all of the solid information. So if nobody has any other questions, I think we are done today. Thank you, Kevin. Thank you, Rich. And thank you all for joining us.
You bet. Take care, everyone. We'll talk to you soon. Bye-bye. Thanks, Rebecca.